Welcome to Friday Value Video, and we're in a series on what proper physical fitness training is and isn't. And last week, we talked about the types of physical fitness training, and I briefly covered them in a little bit of detail, not much. So we're going to go into these a little bit deeper. So right now I want to go into the aerobic fitness or cardiovascular fitness. And, you can read what's written here. It's a physical activity. It does use the large muscle groups of the body. You're using the quads and the glutes and the big muscle parts. You're not really working your biceps a lot. Now, sometimes, you might be on a rowing machine, so you are working the arms. You might be on a fitness machine where the arms are going back and forth. But you're not really building muscle here per se, as you are increasing your heart rate. This activity is very repetitive. It's very rhythmic. Might increase your speed, decrease your speed, depending on your goals and what you want to do. And there's a lot of different types of aerobic activities that you can choose to achieve aerobic fitness. And aerobic fitness simply means that your heart rate is a very healthy heart rate. Your blood pressure is healthy, and it's sort of it's how much oxygen that your body uses. And the more big muscles you open up, the lower your blood pressure will go. I mean, when I was working in the clinic setting, we had a cardiovascular gym next door to us, cardiovascular rehab or cardiopulmonary rehab. I apologize. It was for cardiac patients and pulmonary patients, people who had heart issues and lung issues. And you did very different work for the heart patients than you did the lung patients. Because the lung patients, if you opened up the big blood vessels and you required a lot more oxygen to be delivered to the quads and the glutes, the pulmonary patients, the lung patients, they would be out of breath and they wouldn't be able to do a thing. So those were the people who used the arm bikes because they used the smaller muscles to require less oxygen. But the heart patients, we use the big muscles, the the quads, the glutes, the big muscles want to open up those blood vessels, require a lot more oxygen, and that would literally reduce the blood pressure. So, and it would help them to get their heart healthy. So, depending on what you're doing, you can walk, you can run, you can ride a bike, you can swim. There's a lot of different ways that you can do this. But the biggest goal of this, you can walk outdoors, right? You can walk indoors in the malls. You can do indoor tracks. You can use a treadmill. So the weather won't necessarily stop you. I didn't put it on here, but you can also use an indoor, little mini trampoline. They're called rebounders now, and there's a whole world of rebounders. But you're going to get, depending on what you're using, you can have less stress on your knees and your hips. So if you've got issues there, cycling might be better for you. Maybe even rebounding might be better for you, but you got to know what you're doing so you don't hurt yourself. And then there's rowing machines, there's stair climbers, there's ellipticals, there's treadmills, which I mentioned. And then, of course, swimming, you can do water aerobics, you can do water walking. So there's a lot of choices. So pick the one that you like. I remember Jack Medina, who is a very well-known coach in the sports world, and I believe he worked for Kathy Rigby's summer training camp many years ago. I think he ran that, so he knows a lot. And he used to say the most important exercise that you can do is the one that you will do. So pick one that you'll do. If you hate running, then don't try to run. Pick something you're going to enjoy doing and that you're able to do consistently for success. Now, there's also, as I said, we've got some different options here, and I can't seem to get my screen to go forward. There we go. So it went forward too much. So we have this, the aerobic fitness, the physical benefits of this is reducing the risk of cardiovascular disease, reducing the risks of diabetes mellitus, reducing the risks of hypertension and high cholesterol. It can improve your lung function, your bone density, depending on what activity you're doing. There's some specific details on that one. Your muscle strength, your endurance, your flexibility. Again, depending on which one you're doing, it can improve your balance. Now if you're doing a specific thing like bike riding, won't necessarily improve your balance, although you do need to keep the bike upright. It can assist in optimal weight. So there's a lot of benefits to aerobic fitness. There's also some mental benefits. There is a lot. I would highly recommend you read the book Spark. He's written by a psychiatrist. I believe it's Dr. Michael Rady, if I'm remembering the name correctly, but you get these mental emotional benefits. He used to prescribe physical activity to his patients to address anxiety, to address depression, because it works. It does reduce those issues. Get moving. It's so beneficial. Okay, next week we're going to talk about the next type of training, and hopefully you're getting a lot out of this. We'll see you next week.